But one treatment in particular has been getting a lot of attention.
Hydroxychloroquine.
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 Claims about hydroxychloroquine and chloroquine have taken hold of the global consciousness. Online conversations, media articles, and politician statements have quickly and incorrectly labeled it as a cure for COVID-19. President Trump has repeatedly championed hope in the drugs.
The hydroxychloroquine is I hope it's going to be a very important answer. There's a lot of very positive things happening with that. That's a game changer if that's the case.
This false hope has led to widespread panic.
Prescription drug hydroxychloroquine
is now in short supply,
including for people who need them for other serious illnesses.
The frenzy around it is causing some consequences that are possibly devastating to so many people.
The president likes to say, well, what's it going to hurt? Well, it could hurt you if you have heart issues and maybe you don't even know you have heart issues.
We can't just go mass prescribing these drugs to everyone, because then we will have definitely another kind of crisis on our hands.
So how did this one drug become so in demand? And what are the consequences of the attention it's getting? People are anxious about good news on how to fight the novel coronavirus, which has claimed tens of thousands of lives around the world. Hydroxychloroquine and chloroquine are decades-old anti-malarial drugs, often used to alleviate symptoms of inflammation in lupus and rheumatoid arthritis patients. There had been rumblings online about the drugs as a possible treatment for COVID-19 as early as February 2020. In mid-February, a news outlet in China tweeted about clinical trials for the drug. A Facebook post in Nigeria mentioned the drug, and videos in French media appeared calling chloroquine a cure. News about the drug spread around the world. Conversation around the potential treatment started to appear online and in fringe media outlets in the US around mid-March. First, a blockchain investor tweeted a link to a Google Doc he co-wrote promoting the potential cure. Then Elon Musk retweeted that paper. Google Trends saw a spike in search for the drugs. And it was talked about a lot more on Twitter. The hypothesis made its way to conservative-leaning media outlets like The Blaze, Breitbart, Gateway Pundit, and finally to Fox News by a lawyer and co-author of the Google Doc on the drugs.
Again, a well-controlled, peer-reviewed study that showed a 100% cure rate against coronavirus.
He had even used the term 100%, which we know no medicine works 100%. And even Tucker Carlson was rather skeptical of these claims. But for me, immediately it set off a bunch of buzzers that something was off.
The study mentioned on Fox News was conducted by this French doctor and was not well controlled or peer-reviewed. In fact, the journal that originally published the results has since announced the study does not meet their standards. Still, interest in the drug grew, reaching as far up as the White House. Trump first touted hydroxychloroquine at a White House press briefing.
But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results.
Trump then tweeted about the drugs and also retweeted a post on the previously promoted yet flawed French study. The attention from the president and mainstream media outlets gave the theory even more oxygen. Social media companies went after misinformation on the drugs. They removed the original Google Doc and locked Trump's private attorney Rudy Giuliani's Twitter account until he deleted misleading posts. President Trump spoke again about the drugs on April 5th.
And there are signs that it works on this, some very strong signs.
Social media mentions about the drugs again skyrocketed. As hype around the drugs continued, experts were wary of a lack of scientific evidence.
The president has heard, as we all have heard, what I call anecdotal reports that certain drugs work.
Anecdotal evidence is like a Yelp review, but for science.
They're personal stories. They're not controlled clinical trials. And I think that has been the problem, is that the president and some of his advisors are really taking so much stock. They're putting so much stock in these anecdotal or personal stories rather than the science, the actual science.
Studies on chloroquine have been conducted in the past on different kinds of coronaviruses.
CDC looked at this back in 2005 after the initial SARS virus and found that it was active in a cell cultures. And so when they tried with chloroquine into a mouse model, it didn't work against the initial SARS virus, which is a little bit of a red flag that, this is a little unusual.
The World Health Organization, university labs, and governments around the world are now conducting larger clinical trials of hydroxychloroquine and chloroquine in treating COVID-19.
There's very little evidence that we actually have that this actually has a clinical benefit, which is kind of bad for something that's being very heavily promoted. Like, we should probably have some data and some science behind it. Yeah, this actually works.
There have been and will continue to be negative consequences of overpromising the drug's potential. Attention around the drug sparked a surge in demand from doctors and patients, causing a shortage.
So there's people that need this drug that's a life-saving drug for them for lupus or rheumatoid arthritis. And so if they can't refill their prescriptions, like, they have a personal problem and they're going to be harmed.
So if someone asks me what will happen if you can't access it, frankly, I don't know. But I do know that it is possibly very detrimental and devastating to my well-being. When you're already living with an autoimmune condition, you don't know what's going to happen from one day to the next. So the fact that you don't have your medication to depend on, or the possibility that you may not have it when you run out, is a very scary thing.
There are also potentially fatal side effects from taking the drugs for certain people.
They cause heart arrhythmias, and because the coronavirus also can cause inflammation in the heart, the last thing you want them to do is then have irregular heartbeat, and that's what's leading to people having cardiac arrest and dying.
Yet, global health leaders like the World Health Organization and the Food and Drug Administration are clearly interested in the drugs. The FDA even gave emergency approval to distribute millions of doses of the drugs to hospitals across the country in late March.
And we have stockpiled 29 million pills of the hydroxychloroquine. We're sending them to various labs, our military, we're sending them to the hospitals, we're sending them all over.
It's important that we don't put all our eggs in this one basket, and that we continue to look at some of these other well-known drugs.
Politicians are politicizing this particular drug. There are other treatments, there are other clinical trials that people may never even hear about. Scientific communication, which is important for us to be able to share findings across borders, was going to be ostensibly signal jammed by all of this talk about chloroquine.
Over the course of several weeks, posts online, the media, and politicians turned a little-known drug into a 100% coronavirus cure.
The results in France, in China, and beyond have been nothing short of impressive.
Well, there's no question that it's safe.
What do you have to lose? What do you have to lose?
Hydroxychloroquine and chloroquine as treatments for COVID-19 are not backed by scientific evidence. In a pandemic, it's important for everyone to follow the lead of scientists. Rumors on the internet are the least reliable source of information, and politicians are not qualified to give scientific advice, despite even the best of intentions. Thanks for watching the Washington Post Fact Checker videos, brought to you as we work from home. If you hear something or see an online post that doesn't sound quite right, let us know. Send us an email and we'll be sure to check it out. You can follow along and watch more videos by subscribing to the Washington Post channel here. We hope you stay healthy and well informed.